Hi, welcome to the Hair Loss Show. I'm Dr. Russell Knudsen.
And I'm Dr. Vikram Jayaprakash.
Today we're going to do part 2 of our series of talks about gender transitioning and the impact on hair loss. So today we're going to talk about our female patients that are transitioning to male patients.
Welcome to the Hair Loss Show. Dr. Russell Knudsen and Dr. Vikram Jayaprakash discuss issues relating to hair loss and the medical and surgical treatment of hair loss in both men and women.
So obviously not as frequent that we see in clinic and in both our practice, the transition from female to male, but obviously exists. And hair loss in those individuals is a very real consequence of that, because a lot of them are, in order to assist with the transition, are taking high doses of hormones such as testosterone. And if they have, that itself is not a problem, but that in combination, if they've got the gene for hair loss, can sometimes result in very extensive balding in those individuals.
Yes, indeed. And it's challenging when that happens, because basically they've spent their entire life with a great head of hair, and then they make this difficult decision to do the transition. They take the testosterone supplementation, then within weeks or months, they suddenly notice this, to them, horrific consequence, which is the development of a male pattern hair loss.
Yes.
And I'm reminded of one patient who came to me like this, and she, now he, had only been transitioning for 18 months, but was basically now a Norwood, 5,
Yes.
heading towards a 6. And basically finasteride, even using finasteride wasn't controlling the hair loss. I discovered over the 12 months that I treated the patient, trying to stabilise it so that we could talk about a surgical plan, and I had to resort to using dutasteride in the end to do it. So the thing to understand about it is that some people, and you're not going to know this until it happens, if you're a female transitioning to a male, some people are going to have an aggressive version of balding,
Yes.
and some people are going to have a mild version of balding, and you're not going to know until that testosterone pours into your system what you're dealing with and how hard you have to fight it. But because there are no fertility implications for it, we can be quite aggressive.
Yes.
In treating the testosterone supplementation effects on the hair follicle with things like dutasteride and minoxidil. But again, early intervention is critical. So in any of these patients that are transitioning from female to male, if there is any sign of hair loss within weeks or months of testosterone supplementation, it must be treated aggressively, because all of our medical treatments, we've shown this over the last 30 years, are much better at preventing further loss than we are at regrowing hair once it's progressed to a certain stage. You've got to get it early if you're going to turn it around. And the more they lose, the more we have to do, right? So, so it's better to get in early and make sure that we take significant steps early in the process to stabilise them.
But I'm always worried in those individuals, because the progression happens so rapidly in some of them. How we manage, from a surgical perspective, because a lot of them, or some of them anyway, may come going, I really want to have a surgical procedure. And I do worry that, especially in those individuals that have, like the same way we'd manage men that have aggressive forms of hair loss. If you're pouring that much exogenous testosterone into the mix, and if they're losing more hair, and you create a hairline that you're going to have to start and defend that hairline, because if they lose more hair behind that, then it's going to be a challenge.
Like we said in our last video about the transitioning females to males, in the worst case scenario, you are potentially going to do a hybrid model of part hairpiece. I still think that the issue is the same, that the transplantation should initially, in these extensive balding ones, focus on the front half of the scalp. But the other thing is, you've got to work out in these people what level of balding they're prepared to tolerate. Okay, so that's the difference, right? That there's a certain level of balding they can tolerate. And I think that the answer to that is that if they're a little bit older, they're going to tolerate more recession, for example, than if they're younger. And I
Because
think
in their mind's eye, they're not used to seeing a.
plus, it's also
a
acceptable if they're 40. It's
Yeah.
It's acceptable for them perhaps to see a bunch of 40-year-old males around them with a certain amount of recession and feel that they're not going to stand out if they do that. So it's very important again to spend a lot of time in the consultation to work out what they will prepared to tolerate. And I take a kind of a conservative approach to it. You know, I would say to them, well, okay, you've got a significant amount of hair loss here, and we just want to bring it back. But it's the same argument. You know, in this situation, they're used to a female hairline. They've got to get used to the idea of a male hairline. Right? Female hairlines stay low and rounded their whole life. Male hairlines don't. And you know, it's got to be age appropriate. They've got to be able to grow into it. And so it's the same conversation we have with young men. You know, that we don't want to give you an 18-year-old hairline. That doesn't make any sense. We've got to give you something that's going to look natural at 40, 50, 60, 70 years of age, because people are living into their 80s now. So, you know, we've got to have a sensible discussion about it. It's not about, well, I used to have my hairline here, I want it to stay here even though I'm now a male. And so that can't work. You've got to work with them and work on a sensible thing, because there's only a certain amount of grafts that you've got to play with. And you know, as I said, if you save a little bit in the bank for the front anyway, but you don't have enough for the back, well, then a hairpiece can come into play there as well.
Right. But yeah, I think at the end of the day, the conversation is still that or the point to make is that it needs to be a regular conversation, because this is potentially a moving target, and you want to have regular discussions being able to be managed appropriately.
Well, you can't be overly optimistic about it. I mean, if they have started losing significant hair within weeks or months of starting testosterone, you've got a plan for, you know, the worst case scenario, which is extensive baldness, and how you're going to deal with that. And to be brutally honest, you know, with the patient about it as well, and say, well, look, you know, I know you might, you know, prefer not to have to wear a hairpiece, but in your circumstance, with the amount of declining or limited donor hair you have, this is the best way to get around the problem. But you need to find out what they're prepared to tolerate.
Yeah. Well, good. I think that's a good point. Good conversation to have.
So it's, you know, we work. You know, as I said, these patients tend to come to us from endocrinologists and usually have a fairly sort of settled treatment program. But working with the endocrinologists, I think we should be prepared to intervene a little bit if we feel that we're not getting the degree of stability in the hair loss that we need in their best long-term interests.
Brilliant. All right, well, I hope you found that useful. Thanks again for watching. Please remember to like and subscribe to the channel, and we'll see you on the next episode.
Thanks, guys.